Today we have the privilege of welcoming an exceptional physician in the field of integrative medicine. Meet Dr. Virginia Hyannis Lee. Please give her a round of applause. She is a highly skilled doctor of acupuncture and Chinese medicine and a fellow UC Berkeley alumni. She has helped countless patients regain their quality of life. In her private practice, Dr. has successes patients find deep, lasting healing. Beyond her clinical work, Dr. Lee is a lifelong educator and is passionate about sharing her knowledge with the world. She has guest lectured at UCLA Medical School's integrative medicine classes, and she plays a pivotal role as a chair member of the National Acupuncture Detoxification Association, helping to expand the reach of acupuncture for addiction recovery, trauma, and mental health support. So today she is here with you all to bring real-world insights into how acupuncture can help with so many health conditions that most people aren't even aware of yet. To show you how science meets tradition, how evidence-based practice is balanced with holistic care, and how this incredible medicine continues to transform lives in profound ways. Please join me in giving a warm welcome for Dr. Virginia Hyannis Lee.
Thank you. So hi everyone, I'm so happy to be here. I sat in one of your seats before. I was here for a plagues and immunology class from many years ago, and I feel so privileged and honored and happy to be here and get to be behind the stand. See, just a medical disclaimer. So the first thing we're going to start off with, let's talk about the elephant in the room, which is, as you know, I'm an acupuncturist, so I stab people for a living. The first question I get asked all the time is, does it hurt? I heard needles, does it hurt? So let's address that. We're going to talk about what is acupuncture, does it hurt, and what is it for? Let's do a quick thing about acupuncture first. For acupuncture, Johns Hopkins describes it as acupuncture is part of the ancient practice of traditional Chinese medicine. It is a system of healthcare that has evolved over thousands of years to prevent, diagnose, and treat disease. To be fair, TCM has been around for about 4,000 years, and Ayurvedic medicine, originating from India, has been around for about 5,000 years. So it's a lot older than Western medicine. Acupuncture is a practice of using ultra-thin, sterile needles inserted at very strategic anatomical areas. And what is the place where an acupuncture needle is at is called a neuroacupuncture unit. It's a functional concept that views acupuncture points as clusters where there's a lot of nerve endings, there's a lot of blood vessels and connective tissues that are densely packed in this area. And when you insert a needle into one of these areas, it stimulates these structures and sends signals to the central nervous system. And this neuroactivation leads to neurotransmitters being released. And how I like to look at acupuncture is that it's a master reset button for your body and rebalancing your entire body. So let's answer the first question, does it hurt? It is not your flu shot. You guys have probably all had flu shots before and had your blood drawn at some point in your life. That's why most people are scared of needles, because they're like, acupuncture, more needles? Heck no. But actually, most people don't even feel the needle going in at all, because they're much smaller. They're like 30 times smaller than the needles that you're used to at hospitals or from your other doctors. And for some people, they may feel it going in, but they just feel a slight pinch for about a second. And once the needles are in, it's like the calmest you've ever felt in your life. And many patients describe it like a deep wave of relaxation, or it's like a cozy warmth, or it's kind of like a massage on that sore muscle at just that right spot, and there's that relieving moment, which is really cool. Most people who are not needle fans become total acupuncture fans after their first visit. All right, next one is that size matters, the size of needles. So if you look over there, there's the matchstick, and then you have what you guys are used to, which are the injection needles. These are called hypodermic needles. And if you look further up, highlighted, is the acupuncture needle. It's about 0.25 millimeters. My needles that I use are even smaller than that. I use about half of that size, so about 0.14 millimeters. And if you look at it, that's about the width of a strand of hair. It's so tiny, that's why people don't really feel it going in. And I use these needles because they're great for those who are sensitive to needles, great for elderly who have thinner skin, so they're more sensitive to, and kids as well. Quality of needles also matter a lot. If you look over here, you got the good, the bad, the ugly, which is a reference to an old movie. And what you see is the needle tip at 500 times the magnification under an electron microscope. So what I use is the highest quality needles that follow stringent procedures. And if you look at the good needles, this is the highest quality you can get. It's perfectly even and smooth, and it's silicone coated on the whole sides so that it glides in like butter. In the middle, you see the bad needle, and this is actually a really commonly used. They're even like in popular brands. And you can see the tip is off center, and that can potentially cause issues like pain when inserting the needles, which is not fun. And the last one you see is the really, really ugly, cheap needles. Those are like dirt cheap. And it's a real eye-opener. It's such poor quality. There are potential steel fragments, even bacteria from not being sharpened properly. It could cause some pain when being inserted into patients. And that's why it matters to the quality and the size of needles. Next, I want you guys to have a new little toolkit for self-care, because we all need that. And I'm going to teach you 2 acupressure points that work so well, and I'm sure you're going to love it. So the first one is called Dojin, and that is, in Mandarin, what it translates to, fell off the pillow. Because what do you think it's used for? Somebody fell off the pillow and they woke up and it's like, oh my God, my neck, it hurts the whole day. That's not fun. I bet it has happened to one of you guys before. So let's do that. And especially as students, you guys get a lot of neck tension, shoulder tension. It helps with all that. So I want all of you guys to follow along. So between your second and third knuckle, if you go below it a little bit when you raise your hand, the point is just right there. It's in that meaty part of the area. And I want you to grip it, like with your thumb underneath. And I want you to press on that. We're going to press on this for a good 30 seconds. All right, so everyone, let go of your hands. So what I want you to do is I want you to rotate to your right as far as you can. Notice how far you can go. Come back to center and do the same thing on the left side. Notice how far you can go. Come back to center. And now do ear to shoulder on your right side. Excellent. And notice how far you can go. Come back to center and do the same on the other side. All right, now is where the magic happens. Come back to center, y'all. And between the second and third knuckle, again, press in this area. Use your thumb on the back so that you have a better grip, and press on it really hard. It should feel achy, especially if you have neck and shoulder tension. So keep pressing on it. You can knead on the area, or you can just press down on the area. Either way, doesn't matter. Doesn't matter if it's left hand or right hand, they all work. So let's do this for another 10 more seconds. Doing a great job. All right, now I want you guys to rotate your neck to the right. Notice how much further you can go. Come back to center. Do the same on the left side again. Excellent. I see a lot more rotation. Now to ear to shoulders. Excellent. And do it on the other side. How do you guys feel? Anybody want to raise their hands and tell me what did it feel like for them? Okay, you go for it. What's that?
Felt the same.
Felt the same. Okay, we'll do it longer next time. Someone else. Raise your hands. Yes.
I felt like I could turn to my left a little farther because my left side has been hard to turn recently.
Oh. What she said is that she could turn to her left side more, and she wasn't quite able to do that the same way before. So we only did it for like maybe 20 seconds or so, but Acupressure works really well. In a longer lecture, we would be doing it for at least a minute, and that's where you guys can really, really feel the range of motion difference. Do this at home, do this when you're in front of the computer, and you'll see the difference. I had a patient that had really severe neck pain, and she got into a really bad car accident before. I did this acupressure point where I showed her on Zoom because she was not near me, and she told me that her pain would be 9 out of 10 in the car, and when she pressed on it, because she couldn't really drive because of that, she would press on it and she would say, okay, it would bring it back to practically like a 1, and that was manageable enough for her to get home and drive back home. So it makes a huge difference. All right, the next one, I want you guys to all stand up. Go for it. All right, so once you guys stand up, make sure your feet are planted on the ground. I don't want you guys to twist your hip. I just want you to turn your back. So turn your back to your left side as far as you can. Notice how far you can go. Come back to center. And do the same on the right side. And come back to center. Now, what I want you guys to do is, in between the second and third knuckle, kind of like where we were earlier, I want you to go all the way down until you're right about to hit the bone, but back it off just a little bit. Same thing between the fourth and fifth finger. Go all the way down past that knuckle, and right before you hit bone, in that meaty area, press on it, and you can use your thumb underneath just to get a bigger, better grip. And I want you to press on that with me. And what that means is this is your back pain point. And especially for you guys who sit a lot, and we are in a sitting kind of society, most of us, this will help a lot with backaches. And it's like 10% of the population will have back pain at some point. So this will also hopefully help your friends and family as well. So keep pressing down on it. It should feel achy if you have back pain. It should feel achy if you've been sitting all day, which I'm guessing you have. It should be achy if you've been studying for your midterms. So hopefully you guys are studying. Keep on pressing on it for another 10 more seconds, please. Doing a great job. And you should press down to a point where it actually feels achy. You can knead on it, or you can just press down. Both ways works. And you can also do it on your left hand or right hand. It doesn't matter. It will still work. Excellent. All right, now do the same motion as before. Turn to your left as far as you can, and notice how much farther you can go. Do the same on the right side now. I see a lot of smiles. All right, you guys can sit back down now. Thank you for participating. Anybody want to raise your hands and share their experience, please? Let's see. Would you like to share your experience, please? Okay. So what she said is that it definitely works, and it works better than the neck. It's also part of it because we did it for longer for the back one. And imagine if you can do this with acupressure, imagine what an acupuncture needle can do. It can do so much more and has more powerful effects as well. The next thing that we're going to cover is autoimmune disease. In America, everybody knows that acupuncture is really great for pain. It's super well known for that. So I want to introduce you guys to some of the things that are not as common in your knowledge, because I want you guys to know how acupuncture can be so amazing and powerful in treating so many different diseases. And these are the ones that don't get a shout out very often. For autoimmune diseases, this is like where your security system has gone rogue and becomes its own enemy. Imagine that your country, you send your troops to war, and you bring them over and they got shocked, they got scared. And instead of just attacking the enemies, they started attacking the enemies, and they started attacking their own troops. And they're like, I don't know who's around me, let's just kill them all. That's it. That's what we're doing. That's like autoimmune disease, and that is so not fun when it happens in your own bodies. The immune system can't tell the difference between foreign invaders and the body's own healthy tissues. This is when your body creates auto-antibodies. Auto means self. And these antibodies, these autoantibodies, attack and destroy healthy tissues. These autoantibodies cause inflammation, pain, and damage in different parts of the body. And for autoimmune diseases, there are over 100 types of autoimmune diseases. It impacts millions worldwide. And in the United States, about 4.6% of the population, which is about 15 million people, suffer from this every day. So autoimmune diseases affect a lot of people. And there are limitations of Western medicine. In Western medicine, we prescribe primarily immunosuppressive medications, and it comes with serious side effects. And that can include increased infection risk. They might have fatigue or even long-term organ damage from taking these medications. And for many autoimmune conditions, there are no permanent cure, so patients need to manage symptoms for life. So now that I've depressed you guys, let's talk about the positive stuff. How can acupuncture help? Well, acupuncture is like a reset button for your body's security system that's gone rogue. It recalibrates the system so it can distinguish between real threats and harmless cells. Because at that point of the autoimmune, you don't know who you're attacking. You're just like, screw it, I don't know who, I'm attacking everybody. And acupuncture is like, well, let's adjust that. And acupuncture modulate, which means regulate, immune responses by producing pro-inflammatory cytokines and increasing the anti-inflammatory markers like interleukin 10, which helps to shut off excessive inflammation. So think of your pro-inflammatory cytokines as the bad guys in an overzealous immune response fight. Normally, they act like emergency signals that rally your body's defenses to fight off infections or heal injuries. But when these cytokines, like interleukin 1, interleukin 6, tumor necrosis factor, alpha, are excessively produced, they can create a storm of inflammation. And that is terrible for the body. This hyper-inflammatory state not only attacks the invaders, but can also damage the healthy tissues, leading to chronic inflammation and contributing to conditions like rheumatoid arthritis, inflammatory bowel disease, and even complications seen in sepsis, and a lot more than that. And acupuncture basically regulates it and says, hey, bad guys, you're not acting like that here. And then it tells the good guys, like the anti-inflammatory markers, like interleukin 10, and it says, hey, let's do more of that. Let's do it. Interleukin 10 basically tells your immune cells to slow down the production of pro-inflammatory signals. And by doing that, interleukin 10 prevents your immune system from overreacting and causing damage to healthy tissues. I love that acupuncture doesn't actually turn off your system, because when you are taking the medications on the Western side, they dampen your immune response. They are immunosuppressive medications, meaning, hey, don't act up. If there's other diseases, you're going to get sick. And that's kind of the limitation that we have. But acupuncture is like, well, let's fine-tune it just like the Nest thermostat that you guys might have at home. It's like, well, let's adjust it. Too much inflammation, bring it down. Too little immune responses, bring it back up. It can do that. Acupuncture regulates the vagal-adrenal axis, which plays a crucial role in controlling inflammation. It also activates the body's natural anti-inflammatory pathways. It reduces your stress and improves circulation, contributing to better immune function. Acupuncture enhances and fine-tunes without shutting your immune system down. I do want to say, as a note, that acupuncture is not a cure for autoimmune diseases, but it absolutely helps manage and helps the patients to have a way better quality of life, which is so important for so many. Next, we have lupus. There are 4 different types of lupus. We're going to talk about the most common one, which is systemic lupus erythematosus, SLE. And 10 to 20% of SLE cases begin in childhood. And most of them begin in adulthood between the ages of 15 to 44. SLE has more severe manifestations in children like pericarditis, hepatosplenomegaly, and malar flushes. It generally affects more women in childbearing age. 9 out of 10 patients are women. Only 1 in 10 are men. And they mostly affect people of color more often. And there is a blood test that tests for ANA, and it's widely used, but it's not very sensitive. A positive ANA result, more than 90% of the time, means that they do have lupus, but it's not confirmatory because other diseases also use that same blood test. We can say that if it's a negative blood test, most likely we can rule it out at that point. SLE is a chronic, long-lasting autoimmune disease that affects many parts of the body. It occurs when your immune system, which is supposed to protect you from infection and disease, starts attacking its own tissues. This attack causes inflammation, and in some cases, permanent tissue damage, which can be widespread. It can affect the skin, it can affect the joints, the heart, the lung, the kidneys, circulating blood cells, and the brain. It affects major parts of the body, and its symptoms can be mild, it can be severe. And they go through periods where they have flares of active disease, where they have a lot of symptoms, and remissions, where they have reduced symptoms. And what are the symptoms of lupus? Some have arthritis, fevers, fatigue, rash that appears on the face across the nose and cheeks. This is called a malar or butterfly rash. It's one of the hallmarks of it. And you can see from the picture, it kind of resembles a butterfly. And symptoms of lupus can also include skin rashes that can appear anywhere on the body. They might be sensitive to the sun, and that can cause a rash. They may have hair loss. And other symptoms it really depends on where the lupus is attacking. They might have change of color in the fingers and toes from Bernard's phenomenon. They might have swollen glands, swelling in the legs or around the eyes, pain when breathing deeply or lying down. Can you imagine how much it affects life to have that? From inflammation of the lining around the lungs or the heart. They might have headaches, dizziness, depression, confusion, or seizures, abdominal pain even. For men who have lupus, they tend to have more skin, renal, and cardiovascular manifestations than women. And more than 90% of lupus patients will experience some form of joint pain or arthritis. Imagine having hands pain with swelling and stiffness causing significant disability. Imagine for them, morning stiffness can be for up to an hour. It's pretty common. And it makes it really difficult to even have a grip, like you want to open a jar, or even just make a fist. So I'm going to explain SLE as a progression. These are not medically defined stages. They are created to help you guys understand how it progresses. For the preclinical stage, this is where immune dysregulation starts. This is where there's general activation of the immune system, both the innate and the adaptive. The immune system is on high alert saying, hello, there's lots of going on. And this is considered serological abnormalities. They may present with clinical features, but they don't meet any clinical criteria for the diagnosis. This is why lupus is considered like a chameleon disease, because it just changes so much. It can attack so many different parts of the body. It mimics other diseases, and it takes a really long time for the average lupus patient to even get a diagnosis, which is very frustrating. And at this point, it's considered undifferentiated connective tissue disease or incomplete lupus, but it will transition to clinical lupus later on, and at that point, it will fulfill the medical criteria for diagnosis. And in the early stage, this is where they have mild symptoms. Imagine this kind of like you got a house and the porch is on fire, which is so not fun. and close to our hearts because we live in California, where there are lots of wildfires. In the early stage, their first symptoms that show up are usually triggered by stress. It can be from pregnancy. It can be from giving birth, which sucks. It can be from hormones. It can be from sun exposure, infections, and other stuff. A lot of things can trigger it. And common early symptoms can include fatigue, joint pain and stiffness, skin rashes, photosensitivity where the skin worsens in sunlight, and unexplained fever. And some progress to more severe. In the moderate stage, this is like your wildfire spreading. And this is where there's organ involvement that's starting. There's inflammation that's spreading to organs, causing more severe symptoms. And the immune system continues attacking those tissues, causing flare-ups followed by remission periods. And this is usually the stage where doctors do blood tests. And the key organs that could be affected include the kidneys. Autoantibodies can attack kidney tissue, causing protein in urine, swelling, and kidney dysfunction. You need your kidneys. Lungs and heart. There could be inflammation of pleura, causing pleuritis, and pericardium, causing pericarditis. And it causes chest pain and breathing issues. And they also have a high risk of coronary artery disease due to coronary vasculitis. It can affect your brain and nervous system. Lupus can cause brain fog, memory problems, even focal or generalized seizures. It can cause intractable headaches where it's like, oh my God, I can't stand this anymore. And it can cause demyelinating syndrome, including optic neuritis, movement disorders, including chorea, and cognitive dysfunction. And it can also, SLE can attack blood vessels, where there's an increased risk of blood clots, antiphospholipid syndrome, leading to high risk of strokes or heart attacks. So when you think about it, it's kind of like if you're going to go to war and you don't know where to attack, there's a huge country and there's so many different borders. It's the same thing with lupus. Lupus is like, okay, let's attack the northern border or let's attack the southern border. That's why these symptoms are crazy. There's so many of them and attack so many different systems, and also why it's so hard for doctors to be like, hey, is it lupus? I mean, it kind of looks like this other disease because it's attacking so many places. In this severe stage, this is like your wildfire that has reached historic, big proportional levels. And at this stage, there's permanent organ damage occurring from ongoing inflammation and tissue destruction. And the immune system is highly dysregulated. There could be serious complications here. You're looking at end-stage kidney disease, severe heart disease. There could be neuropsychiatric lupus, where there is seizures, strokes, and lupus psychosis, where you don't even know what reality is anymore. And there could be chronic infections because of the weakened immune system. And Western medications, these are the types that are commonly used. Immunosuppressants inhibits the immune system and prevents organ damage. And all these drugs, they can help, but they cannot fully manage the patient in general because of the side effects. Long-term use of them have so many side effects. They're susceptible to infection, so they get sick a lot. They could have osteoporosis, hypertension, and organ toxicity. And even with the medications, they may not have complete disease control. What that means is they're still not achieving complete remission. They still got lots and lots of symptoms. And they continue to experience all these flare-ups that is destroying their quality of life. So how does acupuncture work? Well, acupuncture helps by regulating the immune system. Modulating means regulating. It reduces the inflammation in the body. It helps relieve the pain, and it improves overall body function. Let's talk about the specifics. Acupuncture regulates the immune system, kind of like imagine a really hyperactive security system. Acupuncture regulates it by affecting T cells, B cells, and pro-inflammatory cytokines. These are proteins that trigger inflammation. Studies show that acupuncture lowers excessive inflammatory markers, like TNF-alpha, interleukin-6, and interleukin-1 beta, while also increasing the anti-inflammatory cytokines like interleukin-10. So it creates a more balanced immune response, which is critical. A study in the Journal of Inflammation Research found acupuncture reduces excessive immune activation in autoimmune conditions, including lupus. Acupuncture also calms this overactive security system by allowing it to function normally and respond only when there's a real threat. But acupuncture is like, hey, we're not doing that. That's crazy, that's not normal. And so, in the study of Journal of Inflammation, they found that acupuncture reduces these excessive immune activation in autoimmune conditions. Acupuncture also reduces inflammation. Think of it like a fire extinguisher. In lupus, the body's constantly on fire due to uncontrolled inflammation. Think of inflammation like a building fire that just keeps reigniting. And in lupus, the body keeps adding fuel to the fire, making it worse. What acupuncture does is it reduces that inflammation. It's kind of via vagus nerve stimulation, and it cools down the flames before they cause further damage. Acupuncture stimulates the vagus nerve, which activates the cholinergic anti-inflammatory pathway. And this pathway tells the body, shut down unnecessary inflammation. And it does it through the hypothalamic pituitary adrenal axis. Acupuncture also reduces inflammation, where pain in lupus, it comes from inflamed joints, muscle stiffness, and even nerve damage. Acupuncture stimulates sensory nerves like A delta and C fibers in the skin and muscles, and it sends signals to the spinal cord and the brainstem of your body. And this triggers the release of endogenous opioids. These are your body's natural painkillers, like endorphins and enkephalins, which block pain transmission in the nervous system. It also inhibits pain perception in the brain's pain centers, which is the periaqueductal gray area. The periaqueductal gray releases a chemical called enkephalins, which act on the raphe nuclei, which is in the brainstem of the body, which further releases serotonin. And what serotonin does is that it inhibits these nociceptive receptors. These are your pain receptors. And basically, it effectively blocks the pain receptors. Imagine pain signals are like cars stuck in traffic on your way to the brain. The more cars, the more pain signals there are, the worse you feel. Kind of like traffic. The more cars there are, the more you want to shout at people. Acupuncture creates extra lanes for nerve signals that tell the brain, hey, reduce the pain. And it acts like a traffic controller, clears up the congestion, we need this for LA traffic, and let pain-relieving chemicals flow. There's a meta-analysis in a Journal of Pain that found that acupuncture significantly reduces chronic pain by enhancing the body's endogenous opioid system. This is like your own body's version of morphine. Like if you ever wonder how come you can take morphine and feel the effects and be like, oh wow, I feel high or I feel less pain. It's because your body already has these receptors and your body makes these themselves. Acupuncture also improves blood circulation. Think of it like a clogged water pipe being cleared. Poor circulation in lupus leads to Raynaud's syndrome, the Raynaud's phenomenon, where you have cold hands and feet, and joint stiffness and muscle pain. Acupuncture dilates these blood vessels by increasing nitric oxide production and improves the blood flow to these affected tissues. And studies in microcirculation found that it helps increase microcirculatory blood flow in chronic inflammatory conditions. In SLE patients, a lot of them have chronic fatigue, and it's linked to dysregulation of the autonomic nervous system. This leads to just having terrible sleep, and when you wake up, if you don't sleep well, what happens? Daytime exhaustion. Acupuncture activates the parasympathetic nervous system in your body, and it says, let's reduce this sympathetic overactivity. A study in the Sleep Medicine Reviews confirmed that acupuncture improves sleep onset, duration, and efficiency by increasing your melatonin levels and your serotonin levels. So acupuncture works on SLE by regulating the immune system, kind of like calming an overactive alarm system. It reduces your inflammation. It relieves the pain, kind of like controlling traffic for pain signals. And it improves blood circulation and clogs the pipes and enhances sleep and reduces fatigue, which resets the nervous system.
6 years old, I was diagnosed with migraines. I had my first one around age 6. And I was diagnosed with lupus in 2016. And it's been a struggle, pain-wise and inflammation. It has gotten so bad that I actually need help bending my arms and legs at times where things get so stiff. And I've been getting acupuncture. This is my 4th appointment right now. Almost immediately, there was probably a 40 to 50% reduction in pain levels. I have a lot more mobility now. In terms of the muscles stiffening that those of us with lupus are used to, as soon as the needles go in, I can feel the muscles relaxing, which is just absolutely amazing. My mobility is much better. I don't wiggle and wobble as much when I walk down the hallway, which is also good. It is something that if you're going to do it, I would recommend a minimum of 2 times a week. I can tell you it's worth it. I do feel really great afterwards. Sleep is always better that night. There is hope, especially with alternative medicine. And if you haven't given it a try, definitely I recommend it.
I'm sharing that video because at the end of the day, it's always about the patients, and it's a life. I can give you all the stats, I can give you all the symptoms, but what it affects is really their lives and their quality of lives. And even in 4 treatments, you can see that so many improvements were made, and she'll keep getting better. And it gives them hope and joy. Next, we're going to talk about multiple sclerosis, MS. Raise your hands if you've heard of MS before. There's a lot of you, all right. In the United States, the National MS Society reported that there's about 1 million people in America that have MS. That's why a lot of you raise your hands. You guys might know friends, family, or somebody that has it. And in the world, over 2.8 million people have MS. With MS, imagine this is like, the electric cables to your TV or your charging cable to your phone. Well, in MS, their body's communication network, imagine it like a series of electrical cables. And envision that these cables are losing their protective insulation, and that's causing the signals to short fire or misfire. In MS, this is where the immune system mistakenly attacks the protective covering of these nerves, and it leads to disrupted communication between the brain and the body. You guys might know of MS because of Selma Blair, and also some other Hollywood stars have it. She was in Legally Blonde, if you're wondering. And that's her using a cane because of her MS. MS is a chronic autoimmune disease, and it's where the body attacks the central nervous system, specifically targeting the myelin sheath. This is the coating of your nerves. It protects the nerve fibers in your brain. And this demyelination disrupts the efficient transmission of electrical impulses along the nerves, and it leads to a wide range of neurological symptoms. There could be physical symptoms, like they might have muscle weakness, coordination and balance issues, or numbness and tingling in their limbs, or vision problems. They could have cognitive symptoms. That can include having trouble remembering stuff. Hard to be a student with that. Having trouble with focusing, attention, and having trouble with problem solving. With emotional symptoms, they may feel a lot of anxiety, like when is the next flare-up going to be? There could be depression, like kind of feeling hopeless about the situation. There could be mood swings, and they're really common. The limitations of Western medicine is that Patients may experience side effects from their medications. It could be mild, like flu-like symptoms, or it can be severe, like increased risk of life-threatening infections even. And not all patients respond favorably to whatever treatments are already available. Now let's talk about the less depressing side, which is acupuncture. There's science research that acupuncture offers symptomatic relief for people with MS, especially with managing their pain, muscle spasticity, fatigue, and improving their overall quality of life. Acupuncture regulates the neurotransmitters. Acupuncture stimulates the release of neurotransmitters, such as endorphins and serotonin, which helps alleviate their pain and improve mood. This regulation may help counteract the dysregulation seen in MS. Acupuncture also has anti-inflammatory effects. It can reduce levels of pro-inflammatory cytokines like interleukin-1 beta and TNF alpha, and increase anti-inflammatory cytokines, interleukin-10, for example. This cytokine balance may decrease central nervous system inflammation associated with MS. Think of inflammation like your wildfire. It's causing damage in the nervous system, and acupuncture is like that rain shower, helping to douse the flames and prevent further destruction. Also, acupuncture promotes remyelination. There's research that indicates acupuncture can promote the expression of neurotrophic factors, like brain-derived neurotrophic factor, called BDNF. BDNF supports the neuronal survival, meaning it helps your nerves survive, and it could help facilitate remyelination, so making sure you got a good cable around those wires. And it can potentially help with repairing the damaged neural tissues. In Western medicine, there's no medication like acupuncture that can help with the BDNF like acupuncture does. That's why it's extremely important, and also why I want to bring this to your attention, because most people have not heard of any of this. For MS-related pain like neuropathic pain, it can be really hard to manage, and thankfully acupuncture is really great with pain reduction. In fact, they've even done open heart surgeries in China with only acupuncture as anesthesia. I personally wouldn't do it. I'd like to be knocked out if I'm in a surgery, I'm just saying. It has been done before, many times. They've even done, patients have C-section surgeries with only acupuncture as anesthesia. Also, I'd like to be knocked out, but that's just me. Acupuncture also helps with spasticity and muscle control. It shows that acupuncture reduces the spasticity, the muscle stiffness, and helps improve mobility and comfort. And it also limits the excitability of these nerves, and in the process, it increases the range of motion. And acupuncture can also help with the bladder function improvement. A lot of MS patients have bladder dysfunction. Acupuncture can enhance the bladder control so it doesn't feel like you gotta keep going to use the restroom. And it reduces the urgency and incontinence. This is a video of my patient.
Hi, my name is Lori Marceau. I've been struggling with multiple sclerosis for the last 19 years. It affects sore all over, just exhaustion, and especially today with the acupuncture. I've been going to Dr. Lee probably about 5 months now, and definitely noticed a difference. Today she did a treatment on my eyes. I have silent optic atrophy, so basically I have pain, just floaters all the time, just blurry and really light sensitivity. And today during the session, I just immediately, once those needles went in, my eyes started to water, like in a good way. And it just relieved the pressure that I was feeling from back, that just pulsating pain. So it just made me feel a lot better, and especially still right now, just feels really good, basically, to walk around. And I know every time I come to the acupuncture, it's, she always does something different for the eyes or the exhaustion. It feels really good, and I just enjoy the acupuncture a lot.
So again, it's all about helping patients to live as full a life as possible, no matter what conditions that they have. And these autoimmune conditions, as you can tell, I've treated that patient for over 5 months at that point. And it's about trying to give them as much of the quality of life to be able to move. She was able to walk the stairs later on, which is exciting for her. She was able to work more than she could before, because before she had to stay home a lot. And it's these little things that for us we take for granted, but when you are the patient yourself, it's phenomenal to be able to do these things. Never take your health for granted. All right, next we're going to talk about cancer. And talking about not taking life for granted, cancer is horrible. Nobody likes to see diagnosis when they get it. It's scary, it's huge. And cancer can infiltrate and destroy normal body tissue. And cancer is basically where you have abnormal cells that are dividing crazily, uncontrollably. Cancer is the second leading cause of death in the world. This is a picture that you guys can look on your own about the incidence of new cancer cases around the world. Lung cancer, breast cancer, colorectal cancer, prostate cancer, stomach cancer. These are extremely popular ones. Raise your hand if you know somebody who has or had cancer. That is a lot of you. For breast cancer patients, and just cancer patients in general, acupuncture can do so much. It's phenomenal. It's not to cure cancer, but it absolutely helps them to have the quality of life and to help manage their symptoms while they're going through chemotherapy and radiation and other treatments. For breast cancer, a woman born today has about 1 in 8 chance of being diagnosed with breast cancer at some point. That's a lot of you. There's a lot of women in this room. That's a lot of people who will get it. One of the common symptoms is chemotherapy-induced nausea and vomiting. Acupuncture significantly reduces nausea and vomiting in breast cancer patients going through chemo, and that's a huge thing for them. It's so uncomfortable, and there's a lot of vomiting. Acupuncture also helps with regulating temperature fluctuations for patients that are going through hormone therapy and having really uncomfortable hot flashes. This could be from medications like tamoxifen or aromatase inhibitors. Acupuncture can also help with pain and joint stiffness. It significantly improves for breast cancer patients, and it helps them to have improved mobility, which gives them some of their lives back. It also helps a lot with cancer-related fatigue. It helps alleviate this persistent fatigue in survivors. Acupuncture also helps with peripheral neuropathy from chemotherapy, where it can prevent and even reduce the severity of chemotherapy-induced peripheral neuropathy. It also helps with anxiety and depression in these patients. For lung cancer, it is the 3rd most common cancer in the United States. Most people in the US will die from lung cancer than any other type of cancer. And this is true for both women and men. Clinical trials suggest that acupuncture can help reduce shortness of breath, which is called dyspnea, symptoms, and improve oxygenation in lung cancer patients. Like, who knew acupuncture could do that? It can help with chemotherapy-induced nausea and vomiting, pain and neuropathy that we talked about, and it can also help with improving sleep patterns and reduce insomnia while they're undergoing treatments. Imagine that, you have cancer diagnosis and you just can't sleep. Acupuncture can help you at least alleviate some of that. And when you sleep, there's less inflammation and you feel a little bit better and less stress too. Again, it helps with colorectal cancer. Not counting some kinds of skin cancer, colorectal cancer is the 4th most common cancer in men and women. It's the leading cause of cancer-related deaths in the United States. It helps with chemotherapy-induced nausea and vomiting, peripheral neuropathy from chemotherapy. It can help with the fatigue, and it can also help with bowel function and digestion. It can support gut motility and alleviate chemotherapy-related digestive issues. For head and neck cancers, They account for about 4% of all cancers in the US. A lot of them, when they go through treatment, they get xerostomia, which is the radiation-induced dry mouth. Imagine the driest your mouth ever has. Like, have you guys ever seen the cinnamon challenge? Where you put a teaspoon and you're like, holy cow, I can't breathe practically, and it's so overwhelming and dry. It's like that. Clinical trials show that acupuncture is effective in reducing dry mouth symptoms caused by radiation therapy. It also helps reduce pain and inflammation in the head and neck cancer patients and makes them more comfortable. And especially when you're going through cancer, every little bit of comfort counts. It also helps them with swallowing function and speech recovery. It helps support these nerve function and helps with the swallowing recovery following radiation. It also helps with fatigue and stress, of course. And this is one of my patients who had head and neck cancer. I'm going to play the video.
Hi, my name is Rebecca, and I had gone through about 7 weeks of radiation treatment for head and neck cancer, and after treatment was suffering from gastroesophageal reflux, as well as dry mouth and insomnia, and acupuncture has really helped me. So for especially the gastroesophageal reflux is almost completely gone. The insomnia is gone as well, and the dry mouth is improving. So it's really just been an amazing treatment.
And this is her on a different occasion where she talked about post-operative nausea. So for some people, they don't respond well to anesthesia. Some of them get really, really nauseous.
Hi, my name is Rebecca. I've been coming to see Dr. Lee for a while now. Just recently, about 3 weeks ago, I had surgery on my neck to remove what used to be a cancerous mass. And since then, I have been having some issues with numbness, with neuropathy in the facial nerve area because it was stretched during the surgery. So my ear and along my jaw and above where the wound is. And after just one treatment today with Dr. Lee, I'm already noticing some difference, some lessening of the numbness and feeling like it's not as tight in that area, like the skin is more loose and some of the swelling has gone down. So it's already helping.
So even in a treatment, acupuncture can do so much for cancer patients and their symptoms. I'm going to skip to sports, since most people follow sports and are more excited when we talk about that. In terms of sports acupuncture, it can help a lot with athletic recovery. A lot of people might have noticed, you guys might have seen it, on the NBA teams, they have not just basketball, but also cupping marks, which are super cool. Cupping creates a suction on the skin, which draws the blood to the affected area. And this increased circulation may help deliver oxygen and nutrients to the tired muscles and assist in removing metabolic waste products. And this helps promote faster recovery. And it also helps reduce muscle tension and pain and decrease inflammation. And it also enhances tissue mobility. So it releases restrictions in the fascia and it helps restore normal muscle function and flexibility. It helps potentially reducing the risk of injury and helps athletes to perform at higher levels. And this is our cupping star, who is Michael Phelps. During the 2016 Rio Olympics, Phelps used cupping to alleviate muscle soreness and accelerate recovery between events. Next one, who has watched Kobe Bryant? Awesome. Kobe Bryant actually used acupuncture in his recovery routine to help manage his injuries and maintain performance. At one point, he used acupuncture on his knee and ankle, and he wrote a social media post that said, "Whatever it takes, Mamba, whatever it takes." And in 2013, Kobe went down with a leg injury, but he had a rapid recovery thanks to acupuncture. Another one is Aaron Rodgers. Raise your hands if you have heard of him. Awesome. The NFL quarterback has used acupuncture to help his recovery and enhance performance. One of the greatest times it helped him was when he had a serious strain that occurred right before his playoffs in 2015. Rogers was told, take a full week off and sit at an NFC championship game. But instead, he took to advanced acupuncture treatment and recovered in just a few days for his pain. And by working with the strained leg, Rogers was pain-free, had an incredible game, and throwing for 3 touchdown passes and 317 yards. Next one is acupuncture star Shaquille O'Neal. I like him not because of basketball, I'm sorry. I like him because he's a really fantastic human being who loves helping people. I think he's such an amazing guy. Like every store that he goes to, every place he visits, he always helps kids out or people in need, and I just want to do a shout out. So Shaq is watching this. I love you. And let's see, and also Shaq had a toe injury that makes his 1 or 2 steps slower, in his words, and rebounding and shot blocking have slackened because of it. He did a combination of acupuncture, massage, and meds. Meds didn't work out that well for him. He had an upset stomach from it. Acupuncture helped a lot with his recovery. And Shaquille O'Neal gave was just one of the nice things he's done. He gave 1,000 PS5s and Nintendos to poor kids. He's also just helped so many people. I just think he's so amazing. And this one is a patient of mine who is a sports athlete and allowed me to video him, so you guys can watch.
My name is Brian Andre Pierce Jr. I'm a current student athlete, football player at San Diego State University, and I came here for acupuncture for my hamstring and my groin. I feel that it's very beneficial no matter what you do. You could play a sport or do any physical activity or just have any pain, and I feel like acupuncture is definitely the way to go. It's definitely beneficial to your body, and the recovery it works. For anybody that's scared of needles or isn't sure about getting acupuncture or have any fears, just know that it definitely works, and it's just a little pinch. It's not anything bad. So I definitely recommend acupuncture. I definitely recommend Dr. Lee.
All right, next we're going to talk about ear acupuncture and ear seeds. So ear acupuncture is really effective, and it's deeply rooted in neuroembryology and neuroanatomy, which is the study of how the nervous system develops and functions. It is a powerful tool for health and healing, especially because of how the nerves connect to the ear. It is connected to the auricular branch of the vagus nerve, the auriculotemporal branch of the trigeminal nerve, and the lesser occipital nerve and great auricular nerve. What does that mean? So ear acupuncture, which is what auricular ear, it means ear, it affects the brain. When a point is stimulated on the ear, it sends a signal out to your brainstem. And in your brainstem, there's the nucleus of the solitary tract. Sounds really lonely, doesn't it? It's called the NST, and it communicates with key brain regions like the hypothalamus, which controls your hormones, stress responses, and metabolism. Acupuncture can also balance cortisol levels, which help with anxiety, fatigue, and weight management. It also works on the amygdala, part of the brain. This is the part that processes your emotions and fear. Acupuncture reduces the overactivity in this area, which is why it's used for PTSD and anxiety. Acupuncture also works again on the periaqueductal gray, the PAG, which is involved in pain modulation. Stimulating ear points can trigger the release of endorphins, which are your body's natural painkillers. And when you activate them, they're kind of like noise-canceling headphones, think of the analogy. They don't just reduce external noise, they also help you focus better and feel more at ease. Ear acupuncture is very similar. It blocks the pain signals and stress responses while enhancing the relaxation pathways, which is why people often feel an immediate sense of calm and relief after treatment. And the ear is actually an inverted human embryo in terms of where the functions are. A research by Calzam found that the National Acupuncture Detoxification Association, which Diego and I work for, They found that acupuncture treatment can reduce morphine-induced locomotor activation. That is basically an indication of rats craving drugs. Like, give me more drugs, I need to get high, I need that high, I need that high. And they found that. And it validates the NADA protocol for reducing cravings. They also found that it prevented the development of morphine tolerance in rats, meaning they're like, hey, give me more drugs. Okay, I got used to it. Give me more morphine. Give me more drugs. They got used to it. Give me more drugs. And they found that acupuncture just says, okay, maybe you don't need more drugs, and also, I'm not craving the drugs as much. That's phenomenal for people who struggle with addictions. Also, I think those rats are a little luckier than the other experiments that they could go under. So I think getting high is a better way, I'm just saying. Ear seeds, all about the bling. This is what I use on my own patients. They are 24 karat gold plated, and they use it as a way to, as an acupressure. Kind of like you guys pressing on your hands earlier. This is what you press on your ears. And they're really pretty. I've never had a female or males complain, because the moment they say 24 karat gold plated, they're like, could I melt it afterwards? And this is an example of ear acupressure for post-operative nausea. Like acupressure, as you guys have seen on yourselves, in even like less than a minute, you guys can feel the difference. And this is an example of what it can do when it's on your body for even longer. And this is, by the way, without needles.
Hi, this is Rebecca. I wanted to talk a little bit about using the 24 karat ear seeds when undergoing anesthesia for surgery. I had a surgery back in August. I wasn't seeing Dr. Lee at the time, and after waking up from the anesthesia, I was very, very nauseous and very dizzy, even after having some anti-nausea medicine, and that lasted with me for several days. So it was definitely impacting. And then just having surgery about 3 weeks ago again, I saw Dr. Lee and she gave me the ear seeds, and they helped tremendously. I did not have any nausea or any dizziness at all upon waking up from the anesthesia. So they were really fantastic, and I would highly recommend them. It made a huge difference.
So as you can see, it makes a huge difference for patients, and it doesn't require any needles. It's something you can easily put on yourself or for your loved ones. And in her case, after she woke up from anesthesia, she did not feel like throwing up constantly, which is such an uncomfortable sensation to wake up to. And these are the ugly ear seeds that are available. To the public in general, I don't care for them. I like the 24 karat gold ones. I think they're prettier, and guys and girls don't complain. These ones look like mold, and if I had to go work in public with these things, I would not like it. I'm sorry. I have nice taste. These are the ugly. These are intradermal needles where they go in, and they also look ugly. I don't like them. These are the ones that I use. So just think, like, if you're gonna go for surgery or any other condition and you just wanna jazz things up, like, it just feels so good to have the 24 karat gold plated ones. And it helps your health. When is the last time your jewelry helped your health, right? All right, next we're gonna talk about needles to go. So a lot of patients, I tell them, I'm like, you know how like you go to a Chinese restaurant and you guys order noodles to go? I have needles to go. And I know that sounds so scary right now because you're like, you're gonna stick a needle and I'm gonna leave with it. Well, needles to go, they are super safe, they are surgical grade, and they have these latex-free adhesive on it. It's kind of like a Band-Aid, but more comfortable, and people who have allergic reactions to Band-Aids have tried mine and they're like, oh, I don't have a reaction. It's fantastic. And what it does is it helps elongate the effects of the treatment. And the needles are so tiny, they're barely seeable. This is so zoomed in so you can kind of see it, but when I show it to patients, they're like, I don't really see it. They're like, are you sure there's a needle there? And I'm like, yeah, no, I'm sure it's there. And it's a medical grade tape that's fixed with resin, and each needle is super securely bonded to the plaster so the needle will never separate. And they're made in Japan, so yeah, they work really, really well, and it just helps patients because not every patient can have the time to come frequently. So I incorporate needles to go as a way for them to continue their treatment even when they're not there with me. And Next, and the last part I want to share is just, this is a quote from Dr. Seuss on Oh, the Places You'll Go. I'm just so happy to be here, and I see so much potential in you guys. You guys are all going to do such amazing things, especially you guys are going to be graduating from UC Berkeley. I hope you guys touch so many lives and do so much good. I just want to give a little advice. I always do it at the end of my lectures. I've been doing this my 4th year now. And just some wisdom I can impart, because I used to sit in one of your seats too. Health is your true wealth. There's nothing like it. When I was in my 20s, I had cancer. You never know when you will have cancer or other diseases or autoimmune diseases. Life may be shorter than you think. We're not all going to live to 100. Make good use of it. Make sure that you live according to your values, that you wake up every day aligning to your personal compass. And invest in yourself. Nothing like investing in yourself. You can invest in the stock market, you invest in a car, you can invest in a very fancy house. And guess what? The only fancy house you ever live in is your body. That's the only thing that you truly live in. Houses come and go. It might be burned in a fire. You might buy 5, 10 other houses. I hope you do. But the only home that you live in is your body. So please, please, please take very, very good care of it. And also, some of you guys might have a fear of rejection. The way I like to think of it is kind of like in economics. It is a sunk cost if you don't ask for help. Ask for help. I know it's so hard at your young age to do so, but the answer is always going to be no if you don't ask. And I've had thousands of doors shut in my face, but I've had amazing doors that opened, and those are the ones that count. And a lot of people would be like, oh my gosh, a door shut in my face. I wouldn't even want to ask after that. And I'm like, yeah, but the answer is going to be no. What does it matter? You didn't lose anything. You can walk away. Another life advice that I find, I hope that helps you, is find a role model that you value and they overcame obstacles just like yours. The reason for that is so many people will tell you advice. Like when you're sick or whatever, they're just going to be like, oh, you should do this, you should do that, you should do this, you should do that. If they didn't go through what you went through, you're going to just not care what they say, honestly. Maybe it might, but it's kind of like, but you didn't go through what I went through, so how do you know? It's kind of my attitude, sorry. But when I looked for role models that actually went through what I went through, I was like, whoa, I have no excuses. Can't do that. And there is a way out of it. They found it. I'm going to do that too. Next one is blue hair. What do I mean by that? Sometimes people will come to you and say terrible things about you. Some people in this world will judge you. And I don't see blue hair, so I think I'm good. Imagine someone shouting to your face, that is the ugliest blue hair I've ever seen in my life. Like, my God, who did your hair? Oh my gosh. But if you know who you are, you know you don't have blue hair, unless you dyed it, but none of you did, so we're good. So if someone says, hey, you're not smart enough, you're not good enough, you are not this enough, and a lot of the world would give you these messages of you are not enough. You know in your heart, yes, you are. When someone says you are not kind enough and whatever they say, when you truly know who you are, it does not matter. You let it go and say that's their own perception. It does not matter. And this is the person looking in the mirror. And when you talk to other people, sometimes they judge you. Think of it like a distorted mirror for kids. Like, as a kid, you've already seen the mirror. When you see a distorted mirror in a funny house or whatever, you know that's not you. It doesn't matter what they say. You're like, your mirror's off. You're the one with the problem, not me. And also I want to say that success is a circle. When I was in college, I did not think of it that way. I thought of it as always having to get the best grades, having to get a good job, having to do this. And there's a prescription where life you have to do all these check marks and say, okay, I did everything on that list. But in reality, think of success as a circle. It needs to be well-rounded. Like, part of that circle includes, how's your body feeling? How about your emotions? How about your relationships with your friends and your family? How about your lifestyle? How about your career, your money, your finances, your spirituality, and giving back? Mine was really linear, and it didn't work for me. And this is Tony Robbins, so I won't take credit. I love that he made this wheel and say it's important to balance your life, and when you're thinking, am I successful? And you guys are all UC Berkeley students, think of how it fits within that circle. Like, what do I need to work on? And another life lesson I want to share is the campfire principle. I got burnt a lot, I'm sure you guys do too, meaning that sometimes people are takers, some people in this world are givers, some are a combo of both. I hope this helps you guys kind of look at somebody like a campfire where are they feeding warmth into the friendship? Are they bringing logs there? Or are they just simply somebody who enjoys the heat? Kind of knowing the difference. And also expired milk, it's an analogy for there are a lot of patients where they tell me, oh my gosh, like we had the best relationship ever and then this person turned abusive, horrible, or whatever. And I tell them milk expires. Meaning that, yes, you can drink milk for a really good long time before the expiration date. It's fantastic. But after milk expires, you're going to get sick. Same way with all the relationships that you guys have in your life, evaluate every so often. Is it making you sick or is it helping, contributing to your health? Also, a lot of patients come in with regret. They're like, oh my gosh, I had a triple bypass, I ate crap, I ate McDonald's, and now I have all these health problems. I feel like crap because I should have, but I didn't, and now I regret. I tell them regret is like a parallel universe. There's a famous author, Cheryl Strayed, one of my favorite authors. She said, it's like the ghost ship that didn't carry you. What it means is regret is like living in a parallel universe. Given the information that you had at the time and your experiences, you were never going to do anything different. And part of going through those hardships is that it helped you to learn the lessons and to become who you are today. Without those experiences, you would not have the wisdom today. And also, one of the things that I really appreciated learning is that, when people look at other people, a lot of times it's like, well, let's judge them by their skills. Like, let's say you've been doing this job in software engineering for 30 years. And I'm like, oh, wow, like you're so skilled. And this person is just a measly little student that just came in interning. Sometimes people in this world kind of look at you like that. Well, I like to say that it's about the person, meaning that your skills will grow, but your compass comes first. So in the medicine, for example, it's not about the skill of the doctor. Some doctors are definitely older than me, some are younger than me. It's about the heart of the doctor, which to me is the heart of a parent who really loves their kids, same way that you would really love your patients. And your skills will grow, the heart matters most. So it's okay that you guys are young, just know that that's perfectly fine. You guys make sure to align your compass to your true north. So I'm so excited for you guys, for everything you guys are gonna do. And we have Q&A, and just thank you so very much, and I wish you guys all the very best life, and I'm always here if you guys need anything. Thank you.